Hey friend, welcome to Grounded, the Vestibular podcast. I'm Dr. Madison Oak, aka the Vertigo Doctor. I am the vestibular physical therapist who is here to help you with all things dizziness, imbalance, and vertigo. In this podcast, we explore the fascinating world of vestibular disorders. Come with me as we dive into the journey to discover the mysteries of dizziness, the brain, inner ear, and the balance mechanisms that keep us grounded. Whether you've been managing your dizziness for one day or for 25 years, we are going to get real about what it takes to manage dizziness, handle the anxiety cycle, and thrive, not just survive, with your vestibular disorder. First, I want to remind you that this is never medical advice. Remember, this podcast is for informational purposes only and may or may not be the best fit for you and your personal situation. It shall not be construed as medical advice. The information and education provided here is not intended or implied to supplement or replace professional medical treatment, advice, and/or diagnosis. Always check with your own physician, medical professionals, and healthcare team before trying or implementing any information found here. Meet me in your coziest chair while we navigate the highs and lows and the twists and turns of the vestibular universe. Welcome to Grounded. Let's dive in. Hello and welcome to the first episode of Grounded. I'm excited to be able to say welcome back, but for this one, welcome. My name is Dr. Madison Oak. I'm really excited about this first episode. We're talking about anatomy and physiology. If you do not know me, the next episode is going to be all about me and my history, how I became a vestibular therapist, fun things like that. So other ways you can learn about me maybe before you listen to this podcast is on Instagram or my website at the Vertigo Doctor everywhere. So let's dive in to vestibular anatomy and physiology. Again, I know this is not the most sexy of the topics, but it is super, super, super important. And I know that hopefully everyone will learn a lot, and then we can always reference this episode as needed into the future. I'm really excited to have you on episode 1. Thank you so much for being here. Please get cozy, get comfortable. Hopefully you're somewhere that you like being. Maybe you're in the car. Maybe you're on your couch. Who knows? Wherever you are, I hope you're cozy and comfy and feeling excited like I am. So first things first is that if you are watching this on YouTube, awesome. If you are not, also awesome and totally fine regardless of what you want to choose. But we are going to be talking about anatomy today, which means that, hey, you know what? We might want a photo. So there is a couple pictures in the show notes in case you want them. But if you're like, I don't need that, I know what the vestibular system looks like, I'm just going to kind of listen in for a little recap. That's great. But if you do want to look at those pictures, obviously do not do so if you are driving. But if you're able to look at those pictures, I think it will be helpful to follow along. They're just below in the description of this episode in the show notes. So let's start with the 3 pieces of the vestibular system. So you have your outer ear, your middle ear, and your inner ear. The outer ear is everything you can see and touch. So you can touch the outside of your ear, right? That part that sticks off the side of your head. And then you have the ear canal. And that ear canal is important because it helps put sound towards your eardrum. And your eardrum is the part of your ear that is the tympanic membrane. And we call it an eardrum because it's sort of like the top of the drum, and it also is used like a drum to carry vibrations into your inner ear, but more on that in a second. The ear canal is the part of your ear that you can stick your finger in or a Q-tip in, even though we are not supposed to. That can cause wax compaction, things like that, but you could put your finger in there, theoretically. The next part that we want to talk about is the middle ear. Now, your middle ear is comprised of two parts that we're going to break it up into. So first you have your eardrum and then your malleus, incus, and stapes. And these 3 little tiny bones are so small, and they vibrate on each other. So they vibrate when I am talking to you right now and you're listening. That vibration vibrates the tympanic membrane or your eardrum. From there, that eardrum vibrates each of those bones and it sends a vibration signal to your inner ear where your cochlea has those sound waves literally go through it and then transmits that to your brain in the Wernicke's area, which is part of your brain that helps you to comprehend speech. Then you have the eustachian tube. That's a second part of your middle ear. What we know about the middle ear is that it is in this like sac, pretty much is what makes it up. And the sac is filled with air. It's sort of like you can imagine a balloon a little bit. I mean, it's not like a balloon that you blow up, but we know with gases like air, there's a pressure volume relationship, right? So when you change different pressure gradients, the volume that is inside of your middle ear of air needs to change. And that tube is literally there designed to let in and let out different amounts of air based on where you are in space. So maybe you've been scuba diving, or you've landed on a plane, or you've dove down in a pool or something like that, and your ear has popped because, or even if you are on a road trip and you drove up or drove down a hill, your ear will pop. All this means is that tube is opening and then closing again, opening and then closing again. And this is controlled by a teeny tiny little flat muscle, and that muscle opens and closes it, and it just regulates the amount of pressure in your ear. And if you can't pop that part, so if you feel like you have a cold and you maybe have some mucus, you're like, oh, I have mucus in my ears, right? That can be because there's mucus in that tube and you're unable to open and close that. Because remember, it's closed at baseline, it opens, and then it shuts again when it lets air pass through it. Okay. The next thing we want to talk about, of course, is our inner ear. And our inner ear is in our skull. It is deeper than the outer ear. It is deeper than the middle ear. It is your inner ear. And I think this is where sometimes there's a little bit of confusion, which is totally fine, where they're like, I got my ears cleaned. Did not affect my inner ear. Or my doctor doesn't see any fluid behind my eardrum, therefore I can't have anything wrong with my ear. We are talking about a piece of your ear that you cannot see from the outside. It would be impossible. You'd need to get a scan, or they can only remove it via like deep surgery, things like that. And you would not want it removed except for in very extreme circumstances, but you really can't get to your vestibular system and to your inner ear very easily. And I'm sure that is by design, because we want to protect this at all costs, because our vestibular system is important and we love it. We like it, even if it's maybe a little bit frustrating. We got to give our vestibular system some love because it is doing its best. Now, what we want to know about the inner ear is that it's made up of two parts. We have our cochlea, and that is our hearing organ. So again, those three tiny little bones, they transmit vibrations into the cochlea, and then it sends the signal to the brain via the cochlear branch of your vestibular cochlear nerve, and then it is interpreted by your brain. Similarly, your vestibular system does the same thing, where it interprets where you are in space, whether or not you're accelerating, if you have moved your head, if you want to move your head, lots of different things, your balance, your equilibrium, and sends that to the brain via the vestibular cochlear nerve as well. Your vestibular cochlear nerve is the 8th cranial nerve. And a cranial nerve just means it comes directly from your brainstem and goes into your body versus going through the spinal cord. So most of our nerves go through our spinal cord. They go down, they cross over, maybe they cross over again. There's very complex, like spinal central nervous system anatomy, but we don't have to worry about that, because in the cranial nerves, they come out of your brainstem. There are 12 of them. This one is number 8, and they go directly to your body. Specifically, this one goes directly to your inner ear, and then it is able to receive signals and send them back to your brain. And that is how that works. Now, the vestibular system in specific, and if you're looking at these photos, you can go to the next one. The vestibular system specifically, it is important because it does lots of really cool, fun stuff, in my opinion, at least. It's maybe type 2 fun, but the vestibular system is comprised of two pieces. So the vestibular system is made up of your semicircular canals, which are your angular motion detectors, and your otolith organs, which are your utricle and your saccule, which are your linear motion detectors. So half of your organs are detecting angular motion and half of the organ is detecting linear motion. Angular motion just means anything that would be not forward, backward, side to side, up and down. Angular motion is like you go to lay back in your bed, or you spin in a circle or something like that. That is angular motion. And that works by fluid moving around in your semicircular canals. You have 3 canals. You have your anterior canal, that's the one on the top. Posterior canal, that is the one that's kind of like back to the side. And then your horizontal canal, which is the one that goes side to side. And we are going to talk about the horizontal canal here just for a second in order to tell you exactly how this works. So remember we talked about it being an angular motion detector. Now there's two kinds of fluid in your vestibular system. There is perilymph and there's endolymph. Endolymph and perilymph are filled with sodium and potassium respectively. Perilymph, potassium, sodium, endolymph. And that endolymph moves around, and so does perilymph. They move around in these separate canals. When we move our head to the right, the fluid moves opposite. When we move our head to the left, the fluid moves with us. So when we move our head, the endolymph and perilymph move back and forth, and they push on something called the cupula, cupula, which is this light pink part in this picture. And the cupula moves back and forth like seaweed in the ocean. So like let's say there's like a riptide or a tide moving to the right in the ocean, the seaweed's also going to move to the right. Moves back to the left, seaweed moves to the left, right? It kind of moves back and forth with you. And really what I mean by that is it's a thin sheet of whatever, and you can think about it in a lot of ways. So I like to think about everything like seaweed, but technically it is like wider than seaweed would be, and it's attached to the top and the bottom and the sides. So it's attached all around. So it's more like almost a sail or a trampoline or something like that. So however you want to think about it is totally fine, but it's in there, and the fluid within your vestibular system is responsible for moving it and therefore detecting where you are in space. When it pushes it one way, it sends a signal to your brain, says, oh, we're spinning to the right. Pushes it the other way, it says, oh, we're spinning it to the left, which is kind of a cool system. So it based on the way you move, the fluid moves, and then it pushes on that thing, and then that sends a signal to your brain that says we're spinning. Linear motion detectors work a little bit differently, and you can go to the third picture for this. And in this picture, blown up is the ear crystals and how they kind of look. So if you want to use your imagination here, this is sort of like a real world example of how this works, except for this would never happen in the real world. Okay, so you picture a nerve, and nerves are usually yellow, right? And on top of that nerve, you have some grass, and it's sticking straight up. It's not like mowed, it's like fresh grass, lawn grass. And on top of there, you have jello. Like imagine you have a perfectly unbroken like pad of jello that's like, I don't know, an inch and a half thick. And then you on top of there have either pebbles or sesame seeds or some sort of like small rock looking thing. Now in this, you now have crystals stuck to a jelly-like substance on top of hair cells, which are sort of like grass, on top of a nerve. This is your linear motion detector machine. Now, it seems very basic, but it works incredibly well. When you tip your head forwards, those rocks move with gravity. So linear, my head is going forwards. The rocks pull on the jelly-like substance with gravity. They all pull forward a little bit. They move the grass or the hair cells forward a little bit. And then that nerve receives that signal and says, okay, I'm looking down, or I'm moving right, or I'm moving left, or I'm going up in an elevator or down in an elevator. And this always reminds me of Willy Wonka's Chocolate Factory, the new movie, which I haven't seen in probably like 15 years, but for some reason, this is what it reminds me of. But if you think about his very fancy special elevator, I don't know why I always say escalator, his fancy special elevator that goes left, right, up, down, side to side, whatever direction basically he wants it to go, because it's Willy Wonka's Chocolate Factory. And if you have no idea what I'm talking about, I'm sorry. But it's basically an elevator that moves any linear direction. And that is how I think about the utricle and saccule. You have one that's up and down, one that's side to side, and they detect different motions based on which way you are moving. So that is how your vestibular system works. Now, the last thing I want to say about how it works is how it sends signals to your brain, because it is always, and I mean always, sending a signal to your brain. Now, this is the way that works. So when you are staring forwards, your brain says, okay, I'm looking forward, I'm looking forward, I'm looking forward. I know where I am in space. And this is beating 24/7 I have both of my hands by my ears. So you can do this with me if you want. If you're in a safe place and you're just listening, awesome. If you're watching on YouTube, also awesome. So put both of your hands up kind of in like a field goal position next to your ears, and then kind of like move them forward and backwards like a centimeter, tiny, tiny amounts. Okay. This is how your vestibular system works. It fires at the same rate on the left and the right when you're looking forward. When you look to the right one says, oh, hello, excitation, fires more, and the left one fires less. And it says, okay, I know that I'm looking to the right. And then to the left, the exact same thing happens where you look right, you look left, and either your left one fires more or your right one fires more, and the opposite one fires less to send it either an excitation or an inhibition signal. This is how your brain knows that no matter where you are, like if you move right and left, if you move up and down, whatever movement you are doing, your vestibular system has a way of sending that signal to your brain saying, does this match my other senses? So me looking to the right isn't just interpreted by my vestibular system, right? It's interpreted by my vestibular system. It's interpreted by my vision, if I can see, if my eyes are open. It's interpreted by my neck muscles. It's interpreted by lots of different things that say, okay, yep, we all agree. And these systems that decide where you are in space work like a system of checks and balances. And I think one of these days I'm going to get in trouble for this analogy, but I'm going to use it anyway because I think it makes a lot of sense. Most people know how the United States government works, and that's how we're going to make this analogy about how the vestibular system communicates with the rest of the body. Your three systems of balance are vision, so the way you see the world, vestibular, our vestibular system, and proprioception, which is the way we feel the world. So whether or not my arm is bent, that is a type of proprioception. Where my head is in space, that's a type of proprioception. Am I walking on concrete or am I walking on the grass? That's proprioception. So these three things work in a system of checks and balances. When you are standing on the side of the road and a car goes by, your vision says, there's something moving, I must be moving. And instantaneously, without missing a beat, your vestibular system and your proprioception should say, nope, we're not moving, we're standing still, we're on concrete, we're on grass, we're whatever. We're on the sidewalk, let's say, so we're standing on concrete, we're not moving. Our vestibular system says, we're currently not tracking any acceleration going that quickly. Okay, great. We're not moving. Vision, you're wrong. Checks and balances is in line. Now, if any of these systems are not working, the other ones go on overdrive. And this is something that we'll talk about in a future episode about visual vertigo. But the simplest way to say this is if you have, let's say, vestibular neuritis or vestibular migraine or Meniere's disease or something else going on, literally any vestibular disorder that you can name, your vestibular system is either not working at 100% or it's not interpreting the information that you are giving it at 100% capacity. And that depends on if you have a peripheral or central vestibular disorder or both. Now, what we need to know about this is that our vision is the thing that takes in information the first, basically, and the most quickly. And so when you are talking about which system of balance you're going to rely on, the answer is vision. And that creates a lot of visual vertigo. And so when you have a vestibular disorder, your vestibular system may or may not be online 100%. And so your vision is saying, well, like if this guy isn't pulling its weight, I'm going to work on double time to make sure this person stays alive, stays upright, isn't falling over. And your proprioception is going to help out a little bit too, but it's just not as fast or as effective as a system. It's a very important system. Do not get me wrong. We definitely need it. It's definitely important. And other things can go wrong if we don't have that either. But in general, your vision is going to take over when your vestibular system has something going wrong with it. So that is something that's important to understand is this system of checks and balances. You can kind of add it as a triangle. I know some other people like to make the analogy that it is like a band with a singer, a guitarist, and a dude playing the drums. And if the guy playing the drums is your vestibular system and they're just completely playing off tempo, then the rest of the band isn't going to be on tempo either. And it's just going to kind of get all jumbled. I like to use the US government because I think it's a little bit funny and cheeky, but also because it is exactly like that. It's supposed to work in a systems of checks and balances. but it doesn't always work in a systems of checks and balances, and one gets too powerful or one's not powerful enough or whatever. Exact same thing happens with your three systems of balance. So now that we have sort of a picture of what our vestibular system is like in our brain and kind of how it works and how it integrates with other systems, let's talk about central and peripheral vestibular disorders, because this is really, really, really important. I cannot stress this enough. And again, I know this is not the most exciting, groundbreaking episode, but it is so important. So let's talk about peripheral vestibular disorders. So peripheral vestibular disorders refers to anything that happens in the vestibular system itself. So if something is going wrong or going on with the actual vestibular system, that's a peripheral vestibular disorder. These are things like BPPV, vestibular neuritis or labyrinthitis, and Meniere's disease. So in these situations, there's something actually wrong with the vestibular system, whether it is chronic, whether it is acute. That doesn't really matter so much to me for this exact example. It does matter in general, but these are all things that are issues with the vestibular system itself. Superior canal dehiscence, paralimb fistula, all those things are also peripheral vestibular disorders. Typically, these will also show up on a video nystagmography exam. That's the one where they put those really big goggles on you. They make you track something back and forth. And at the clinic I used to work at had one that had a smiley face you followed, and then they turned off the lights and they turned on the lights, and they put a laser that you focused on, and then they did all these different tests, right? And then they lay you down, they put either cold or warm water or air in your ear. And people typically do not like this test because it will elicit a vertiginous response, which it's supposed to do. That means you are passing the test. That's great. And those types of things, again, those are peripheral vestibular disorders. This means that your brain is not receiving the signal that it's supposed to be receiving. The easiest way for me to explain this is with vestibular neuritis. So a second ago, we talked about the way that our vestibular system fires. So it fires forwards all the time, saying, I'm looking forward, I'm looking forward. When I look to the right, my right side fires more, my left side fires less, and my brain understands that I am looking to the right. And vice versa. All day long, this happens. When you have a vestibular neuritis, one side or the other side doesn't function as well. This just means that, let's say, for the argument of this episode, you have a left-sided vestibular neuritis at 100% loss. So you have no vestibular function on your left side, but you have full function on your right side. This is sending your brain a signal saying, I am looking to the right, but your neck proprioception, your eyes, the way you know about yourself says, I'm looking forward. It is impossible that I'm looking to the right. But your vestibular system is firing more on the right and less on the left, which means that your brain is receiving a signal from your vestibular system, which is typically pretty trustworthy, saying, nope, we're looking to the right. This is going to cause imbalance, nystagmus, which is involuntary eye movement. It's going to cause lots of different issues that are all saying we are not in balance. Now, the cool thing about your brain is that it can rewire itself to understand that this 0% function on the right and 100% function on the left, or vice versa, is your new normal. It's pretty cool because your brain says, hey, I now understand that my vision is saying that I'm wrong. I'm working the systems of checks and balances. I have some pretty serious gaze instability, but vestibular rehab is going to help me with that. And I'm going to slowly compensate. My brain is going to get better. And I am going to slowly start to understand more and more where my body is in space. Understanding where your body is in space is so, so important. And that's all your brain is trying to do, because our brain is a prediction machine. Our brain is designed to do one thing and one thing only, and that is to keep us alive, right? And so if our brain says, oh my gosh, we are a little bit off balance, all of our focus and our energy, whether we like it or not, is going to go to balancing us and finding a way to feel safe and finding a way to balance ourselves. And so our brain is pretty cool and pretty amazing in that it will do that, but it's going to take some time. More about how that works in the future, of course, but that is how a peripheral vestibular dysfunction works physiologically. Now, a neuritis is much different than Meniere's disease, is much different than superior canal dehiscence, is much different than BPPV, but they're all different dysfunctions of the same organ. Now, you can absolutely have more than one. You could actually have every single one of the things I just listed. Now, that would be pretty uncommon, but it's definitely possible. So definitely knowing about yourself that, hey, just because I have one thing doesn't mean it's not mutually exclusive, is all I'm trying to say. The next thing we want to understand are central disorders. So central disorders are things that we hear about like vestibular migraine, persistent postural perceptual dizziness, concussion, stroke, some other sort of brain injury that can make you dizzy. And these are problems with the brain itself and the brain and spinal cord. So for instance, vestibular migraine is a neurological dysfunction of the brain. It's a neurological disorder that you live with 24/7. It is a chronic illness with acute presentations and chronic presentations. And that is definitely the most common of the central dizziness disorders. It is the most common cause of central dizziness and vertigo. About 3% of the entire adult population has vestibular migraine. It's a lot of people. So you're definitely not alone if you are living with VM. Now, this is not a peripheral vestibular issue. Now, there are people, again, who have peripheral vestibular disorders and also central vestibular disorders, but central vestibular disorders are not because you have a peripheral dysfunction. Central vestibular disorders happen because you are not processing the information from your vestibular system accurately. So people with vestibular migraine, which is what we're going to use for this example, come to me and say, well, I have nothing wrong with my testing. Nothing's wrong with my vestibular system. Every doctor keeps telling me I'm normal or that I have anxiety or that something else is causing this. I've been to every doctor in the world, 85 doctors, 100 doctors, which is not unrealistic for some people. I have seen. And if you are one of these people, I am here with you. You are not alone. There are so many people who have seen hundreds of doctors and not gotten an answer for this. So this is because this will not show up on imaging. Now, there are some like studies that of course show, not obvious, but that will show that you have like white matter lesions or something like that on your brain from migraine over time. That is different than what I'm trying to say here, is that there are no tests for this. There are diagnostic criteria. And so sometimes understanding that you have a migraine disorder or that you have 3PD or that you had other things, there are no tests for these things. You can see something like a stroke and sometimes a brain injury on a scan. Not always, but sometimes. But you can't see something like vestibular migraine on most scans or 3PD on most scans. So when we're talking about this, your doctor is probably going to say, well, there's nothing wrong because I can't see the test. And that is normal. That's okay. This is why having someone who specializes in dizziness and vestibular disorders is so important to have on your team. You're not making this up. It's not in your head. I mean, technically, like physically, it is in your head, but you're not making it up in your head. So this is why it's important to understand that not just your vestibular system causes dizziness. The central part of your body, your brain, can be the underlying issue with the dizziness. And it's because your vestibular system is sending the right signal saying, like, I'm working really hard here. Hey guys, I'm working really hard. Hello, I'm trying to send you the right signal. We're looking to the right, we're looking to the left, we're spinning in a circle, but your brain is not accurately interpreting that information. And that is the difference mainly between a central disorder and a peripheral disorder. Now, I want to give you one more example of how we can think about the peripheral and central systems integrating together and creating a picture in your head about what exactly is happening. So what I want you to think of, and who knows if you still have this or not in your house, but I'm sure everyone can kind of relate to what I'm talking about, maybe, is a cable box and a television. So you have a cable box that receives information from the dish or whatever, right? Maybe on top of your house. Not everyone has a dish or a dish, but bear with me here. So you have a cable box. It receives information from some source. It sends that information through a wire to your television, and the television magically makes an image from that. And that magical image comes from all these things integrating together. Now, if you have a TV that is static, right? Like it's just those like black and white things we saw in the 90s that like sometimes we see today, but instead it says like HDMI signal loss, which is not nearly as applicable here. But let's imagine you have that like black and white static on your TV. And if I am already aging myself, oh well. But think about it this way. It can be something wrong with the cable box. It can be something wrong with the wire, right? You might need a new cable. It might be something wrong with your television. And unless you're a really good AV guy, which I am not, I use someone else for that. He happens to be my partner, which is nice, but like I don't know what's going on, or I did wrong when I turn on the TV the wrong way, or maybe there's a storm outside or something like that. And you cannot interpret this information for the television the right way. The exact same thing applies to your vestibular system. Your peripheral vestibular system is the cable box. The wire is your vestibulocochlear nerve. And the TV is your brain. Your brain is in charge of bringing together all of these signals from all over the place and saying, this is the right information from here, from here, from here, from here, and predicting what you need to do next. Now, sometimes we don't predict right. And for instance, that's where rocking and swaying can often come from, is our brain thinks, oh, we are on a moving surface. So I need to predict rocking and swaying. And we need to retrain our brain that, hey, we're not rocking and swaying. We're not moving the wrong way. You're predicting wrong at brain. And your brain has to kind of learn what being still is versus not being still. And so these processing issues is where the person either accurately or inaccurately understands vestibular signals being sent. So I hope that cable box analogy makes some sense. If you have questions about it, please reach out to me on Instagram or via email is totally fine. So this is where people sometimes get mad at me, but I'm going to say it anyway because it's true and I don't want you having inaccurate information. I am all about you getting to make any decision that you think is right for you with the right education. You need to make an educated and an informed decision. So all of these disorders can be treated and managed. Treated meaning there are treatments for them. They do not have cures. And this is where people stop listening to me and tend to tune me out. But I really want you to pay attention here. Just because there are no cures for vestibular disorders does not mean you will be dizzy every day. Let me rephrase that. You are not going to be dizzy every day forever. With the right treatments and the right tools, there are definitely ways to manage this more easily. But you do not have to be dizzy every single day for the rest of your life because of your vestibular disorder. And I really want you to remember that. Because usually when I say, hey, there are no cures, but there are, people stop listening to me. So listen when I say, there are no cures, but this doesn't mean you'll be dizzy every single day forever. Will you maybe have symptoms because you live with a chronic vestibular disorder? Potentially. And kind of wrapping our heads around, I have this thing that's in my body that I manage. When I have an attack or when I feel dizzier, or if I feel dizzy every day, this is what I do to support my body. And saying, I support my body by, I don't know, obviously drinking water is not going to be the end all be all for this, but I stay hydrated. I eat every 3 to 4 hours. I exercise every day. I do breathing regulation exercise. I meditate. I do self-care. I do X, Y, Z. Those are the things that all together as a conglomeration are going to start to kind of put this in the right direction. And no, I'm not saying you're never going to be dizzy again ever, because we are adult human beings And dizziness is a part of the normal human experience. And it's going to be more a part of your normal human experience if you have a chronic vestibular disorder. But you are not going to be dizzy every single day, 24/7, 365 with the right tools. Now, I know these tools not everyone has access to. I'm going to try my best on this podcast. And this is why this podcast even exists, because I'm trying to provide you the resources to do this in a way that works for you, right? Like I am giving you this information, and you can use discretion and talk to your doctor about what might work for you or what things you might need to change. Of course, I'm never giving you medical advice or anything like that, but we do need to understand that, hey, there are things I need to do for this, and there are things I need to do every single day to do this. But also knowing, and this is something we'll talk about in the future, that doing too much stuff can also make us dizzier. And so, like, where is that line for me are things we're going to talk about. Now, the last thing I want to say before I send you on your way is that your brain is like a toddler. And if you're like, what are you talking about? I'm serious. If you have a toddler in your life, whether you are a parent, whether you are an aunt or an uncle, or you knew a toddler at work, or I don't know, you have a toddler in your life. For argument's sake, imagine one. Now, your brain is plastic. Now, when you're a toddler, your brain is so much more plastic than it is now as an adult, but it's still very plastic. And do not discredit your brain. Your brain can always learn. Now, think of that toddler in your life. And from the time they were able to speak until however long they are now, how many times did you or their parent have to ask them to say please and thank you before they remembered even once? Before they remembered 80% of the time? Before they became an adult and remembered maybe 90% of the time? Sometimes we forget. Think about that. This is not a statistic from the internet. This is what I'm going to call a Madison statistic. Probably like 1 million times. Like, you have to remind a small child to say please and thank you so many times before it works. And the exact same thing is true for your brain and your vestibular system. I think there's a lot of misinformation about neuroplasticity. So I want to set something straight before we go into this. Neuroplasticity is your brain's ability to change. And that is a really cool and very amazing thing that your brain can do. And that is called plasticity or neuroplasticity, or your brain being plastic. When your brain is plastic, it means it can change, but you need to intentionally over and over and over and over again remind yourself, oh, I need to do it this way. And the first time you do it, it'll be hard. And the second time you do it, it'll be hard. And the third time you do it, you might be frustrated because nothing's changed. But if you said to a small child, say please and thank you only 3 times, and then no one ever said it to them again that they needed to do that, it's unlikely that it would take less than 15 years for them to understand that, like, that's a social thing that we do, right? And so we all need to repeat to ourselves, I know that I am safe, I am still, I'm going to be okay. Whatever it is that you're trying to teach your brain about, you need to do it intentionally every single day, not just a couple times, thousands, hundreds of thousands of time. And then your brain is going to learn, and then you move on to the next thing. And I know that feels very frustrating and maybe a little bit overwhelming, because you're like, how am I going to tell my brain something a million bajillion times? But you have like 60,000 thoughts a day. And so if you even changed 2 of those, that would be an awesome start in the right direction. And that is the very small way you start. And then the dizziness gets less, even for a half a second. If you're like, oh, I felt kind of clear for half a second today, that is phenomenal. I'm very excited for you. If you're like, I had a morning without dizziness, and then it usually changes to, I had 1 extra hour of dizziness, or I was able to do 1 extra thing before I got dizzy today. Those are all signs that you're moving in the right direction and your neuroplasticity work is working. And we need to remember, it's not only neuroplasticity that's going to help you through this. This is a small piece of the puzzle. We need to be doing lots of things comprehensively, from medicine and medical care to breathing and grounding exercises, which are on very opposite ends of the spectrum, but all work in the same direction to help you get where you want to be. So we're going to dive into all the things that are possible in helping you to treat your vestibular disorder. And no matter what it is, I want you to remember that there are always treatment and management options. You are never out of options. We are constantly coming out with new research, new things you can try. New doctors are trying new off-label treatments. There's always options. And the goal of this podcast is to get you to a place where you are able to take those options, maybe present them to your doctor or your other healthcare provider, and get yourself the help that you need. And so you can better advocate for yourself. Thank you so much for listening today. I'm really excited for this podcast. If you would like to find me on Instagram, give me a follow at the Vertigo Doctor and the podcast at grounded.vestibular.pod. Remember to rate, review, and subscribe to our channel. And if you're interested in working with me, try Vestibular Group Fit, the affordable, comprehensive program that focuses on movement, mindset, support, and education to take you from feeling frustrated and dizzy to feeling in control of your vestibular disorder. Or we can work together one-on-one in California, Virginia, Maryland, Minnesota, New Jersey, New York, Wyoming, and Wisconsin. Your success story begins today. Dizziness does not have to be forever. Let's get you the right tools to thrive. I love you, and I'll see you next time on Grounded.